kind of calm. I'm going to take a look at your scalp and check your ears to see if we need to do any cleaning. First, I'm just going to slowly palpate, looking for any nodules or signs of inflammation around the earlobe. Color looks normal. Not seeing any lumps. Maybe just one, or very little right here. Seems to be harmless. Noticing a little bit of debris in one of the earring holes. We can definitely clean that. First, I'm going to just slowly touch it and try to clean the skin. This spray has antiseptic properties. It helps to reduce bacteria. Now I'm applying a cleansing foam, so it's going to feel a little bit wet. We're just cleaning the skin to make sure that there is no debris. That's very good. Just breathe through. Take deep breaths in. That usually helps. Okay. And now we're going to clean the left ear as well. First, I'm going to use antiseptic solution. It neutralizes bacteria. It has also antiviral properties, mint and eucalyptus. Okay, that's lovely. Now we're going to use the same cleanser. It's going to feel very foamy and a little bit wet. go ahead and check your scalp next. Looking at hairline. Noticing a little bit of alopecia on the side, which can happen after a certain age, and it seems like it's not very advanced. What we could do is to prescribe some medicated oil that helps with hair growth and regeneration. I'm not seeing any redness going towards the right side of your scalp. I'm going to use a wooden spatula to better inspect the scalp texture. Scalp is definitely on the healthy side. I'm not seeing any signs of vitamin deficiency. But the hair definitely breaks easily, so it's prone to damage. you usually wear your hair in a ponytail?
No, but I used to when I was a kid.
I definitely don't recommend wearing it in a ponytail, at least not a very tight one. That usually damages the hair even more and puts a lot of mechanical strain on it. Have you noticed any itchiness on the right side, right above your ear? Okay. I'm gonna have you flip over and I'm going to take a look at the base of your skull.
Okay.
Okay, so first I'm just going to brush the hair towards me. Then I'm going to take a look at the scalp. I'm gonna look for any lumps or bumps or scars. Okay, definitely noticing a white spot. Seems like it's also a little bit of alopecia. It's right on the right side of your scalp. But so far I'm not seeing any redness. It does seem to have a stronger texture towards the hairline. I'm going to do a few tests here to check the skin integrity since there is a little bit of rosiness, and I just want to make sure that there is no eczema. Okay. We can apply an anti-inflammatory oil. It's going to help to stimulate blood flow in this area. It has vitamin D infused properties. And we're applying the oil directly at the scalp and base of the hair to make sure that it is easily absorbed through the dermis. You're going to feel kind of like a warm, fuzzy sensation. That's going to be localized just where we applied the oil. Okay, I like the texture now. Noticing one small raised papule. It doesn't seem to be infected. Usually we would be worried about a cluster of them, but since it's just one, I'm going to keep an eye on it. A small spider angioma. Noticing one more. They seem to be small in size, circular. There's no need to do any tests. Okay, I would like to do on this side a massage to help stimulate blood flow. You're going to feel small pulsations. This helps to adjust the cranium and bring balance to the bone structure. It also helps with spine realignment and to fix cervical neck posture. Going to apply pressure point therapy on the occipital lobes. Going to work on the lymphatic drainage as well. I'm going to apply a little bit of oil here on the neck muscles. I'm going to apply some acupressure therapy. This will help to relieve the inflammation at the base of the skull. Let me know if it hurts, okay? I'm not seeing any edema, which is a good sign of lymphatic drainage that is functioning properly. Okay, we're finalizing the treatment for today, and on your own time, I'm going to let you open your eyes and you can take a deep breath in to allow for oxygenation to enter your whole body. Hi Anais.
Hi.
It's very nice to meet you. My name is Dr. Matt. Can you please verify your last name and your date of birth for me?
Yes, it's Villanueva. The date of birth is January 8th,
Okay.
1992.
Do you have any allergies?
No allergies.
Okay. Taking any medications on a daily basis?
Yes.
Okay. What kind of medications are you taking?
Take a Prozac
Okay.
and just like the daily vitamins.
Alright. Is that one time a day? The
daily,
Prozac?
yes.
And do you know how many milligrams?
20.
surgeries in the last 6 to 10 years?
No.
Anything in particular that you would like me to address today?
I've had just a little bit of like pain in my neck.
For how long has that been going on?
Maybe a month.
Any changes in your diet?
No.
How often do you exercise?
I try 3 days a week.
Okay, and what kind of exercise is that?
Cardio and weights, upper and lower body.
Do you smoke or drink alcohol?
No. I drink just socially, but very little.
All right, medical history, any hypertension, hyperlipidemia, any diabetes in the family?
Arthritis.
Okay.
And that's about it, I think.
Right. So I do see here just a slight change in weight, about 2 pounds. We're just not concerning at all. It's a normal fluctuation. Would you like to be considered for our vaccines, the flu vaccine?
Yes.
Alright, so let's go ahead and start the exam. First, I'm going to take your vital signs. Any flu-like symptoms in the last 2 to 3 days?
No.
Okay. Traveling outside the country the last 2 weeks?
No.
And now, scale of 0 to 10, how would you rate your neck pain right now?
Right now, maybe like a 5.
Okay, is it localized on the right side only?
Mostly.
Okay, we're going to go ahead and start with the temperature. This will be sublingual, so we're going to observe it under the tongue. Did you have anything hot or very cold to drink right before coming in?
I had a coffee, but it was more mild. It wasn't really hot.
Okay, so I'm going to have you hold this under your tongue. And this will go on your index finger on your right hand. Go ahead and relax for me. Heart rate 71. Oxygenation 98% on room air. Respiratory rate is about 14. So let's go ahead and check your temperature. 97.3, that's normal. And take this off. Alright, this will go on your left upper arm. It's going to feel a little bit tight. Just going to prepare your neck. Okay, go ahead and relax and uncross your legs for me. Uncross.
Oh, uncross.
Nice. Okay, relax your arm. Okay, blood pressure is a little bit elevated, but still within normal limits, 130/60. Okay, now I'm going to have you change into a gown and we're going to start the physical exam.
Okay. Thank you.
Okay, Anais, I'm just going to go ahead and palpate your neck area. I'm going to have you relax. We're looking for any lymphadenopathy, something that would alert the immune system to be activated. Going up the network of lymph nodes here through the back. Just checking the right side of your neck and left. Palpating forehead and sinuses. And under your eyes, checking for any pressure. Checking your nose for any deviation of the septum. So I'm going to go ahead and cover one nostril. I'll have you breathe in, breathe out through your nose. And again. Right side is a little bit obstructed. Palpating mastoid bone behind the ear to see if there's any infection. I'm not feeling anything swollen. It seems to be symmetric. Palpating scalp for any asymmetry, lumps, or bumps. We want to make sure that head is normocephalic. We're going to check hair distribution as well. I'm looking for any signs of hair loss, vesicle malformation, I'm going to have you lift your head a little bit so I can rearrange your hair. Perfect. A little bit of dandruff, something that could indicate a hormonal imbalance. Skin is normal in color. No signs of alopecia. Looking at the hairline as well. We're going to check nerve impulses. So we're looking for any abnormal neurological responses. I'm going to check your facial sensation. Go ahead and tell me if you feel this on the left or right.
Right. Right. Left. Right. Left.
Go ahead and tell me if you feel this on the left or right of your body.
Right. Right. Left.
I'm going to listen for any brewy now. I'm going to have you take a deep breath in and hold it. Hold it for 1, 2, 3. Breathe out. And we'll do that one more time. Breathe in and hold it for 1, 2, 3. Breathe out. Okay, so there's no swishing sounds. I'm going to listen to your heart now. Go ahead and breathe normal. Is it okay if I open the gown a little bit on the side?
Yes.
Okay, I can hear only S1 and S2. No S3, no S4. That's very good. We're going to check for murmurs. Excellent. We're going to measure your head circumference. Go ahead and lift your head up for me. Alright, go ahead and relax. Perfect. Go ahead and lift your head up one more time. Great, thank you. Okay, go ahead and tell me if this feels sharp or dull.
Sharp.
And what about now?
Dull.
Okay, so go ahead and tell me if this feels sharp or dull. Continuing from now.
Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay, that was very good. I'm going to go ahead and do more tests on the scalp area. I do see here a little bit of redness, so let's go ahead and check that. Go ahead and tell me if this feels cold or warm.
Warm. Cold. Cold. Cold.
And how many taps do you feel? 1 or 2?
2. 1. 2.
And does this feel sharp all the way?
Yes.
Does this feel sharp or dull?
Dull.
What about now?
Sharp. Sharp. Sharp.
Does this feel 2 or 1?
2. 2.
Okay. It's still within normal limits, so I'm not concerned. Let's go ahead and do a vision check. I'm gonna have you open your eyes and look straight at the ceiling for me. Okay, pupils are running reactive to light. I'm going to check inside your mouth now. Go ahead and give me a big up. Alright. Tongue is symmetric. Can you please give me a big smile? Good. And now frown. I'm gonna have you frown with your eyebrows too. Perfect. And can you puff your cheeks for me and keep them puffed, okay? Don't let me unpuff them like this. Keep them puffed. Good. And now I'm gonna try to turn your head towards your left. Don't let me do that. Good. And the same thing on the other side. Don't let me do that. Alright. Okay. Now go ahead and shrug your shoulders for me. Perfect. Okay. Go ahead and open your eyes. And the same thing, I'm going to have you look straight at the ceiling and I'll come very close to your eye. We're going to examine your optic disc now on each side. A little bit of redness on the left side. When was your last checkup?
2 years ago.
Okay. Okay, right side looks good. I'm going to have you turn your head towards the right. We're going to check your ears now. I'm going to have you relax. going to feel just a little bit cold, so we're looking for any drainage behind the tympanic membrane. I'm not seeing any redness there. Okay, go ahead and switch. Tympanic membrane is gray. Just a little bit of built earwax. Good. I'm going to go ahead and take a few measurements. So we're looking for any asymmetry. We're going to check the skin for any lesions. You have normal cell growth. Feel for any swelling now. It's going to feel kind of like a pinching sensation. We're looking at hydration status and if there's any nutrition deficiency. Perfect. Listening to the sounds in all four quadrants. Going to percuss now. It's going to feel kind of like a tapping sensation. I'm going to check for any kidney pain. I'm going to slide my hand right under each side and gently press on top. Any flank pain there?
No.
And we'll do the same thing on this side. Good. Now I'm going to slowly palpate on each side. I'm looking for any swelling, tenderness, or crepitus. I'm going to check for diastasis recti. So I'm just going to put 2 fingers to see if they fit in between the abdominal muscles. Okay. Very good. Okay. Now I'm gonna have you flip over on your side and we'll check your spine and your back.
Okay.
I'm going to go ahead and check the spine. I'm going to look for any lesions. Go on and tell me if this feels sharp or dull.
Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp.
Okay.
Sharp.
Good. I'm going to check for any abnormal nerve impulses. Go ahead and tell me when you don't feel the vibration anymore.
No. 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 No.
I'm going to locate the cervical spine. I'm looking for any malformation of C1, C2. And checking for any scoliosis. Okay. Normal hydration status. Measuring spine and upper back. That's perfect. So now we're going to go ahead and check your legs. So I'm going to have you flip over on your back. Okay, nice. I'm just going to go ahead and take a look at your legs and feet. So we're looking for any redness, swelling, edema, and asymmetry. Both legs look normal color. Just going to go ahead and press down to see if there is any edema. I'm going to check pedal pulses to make sure that they are strong and symmetric on both sides. Good. Good. I'm going to check capillary refill within 2 seconds. That means there's good peripheral circulation. And I'm going to go ahead and slowly palpate. We're checking for temperature to make sure that they're both the same temperature. I'm going to do some strength tests. I'm going to try to open your legs. Don't let me do that, okay? Good. And now I'm going to try to close them. Don't let me do that. Good. Now I'm going to put my hands right under your pads. Go ahead and push as strong as you can. Good. And I'm going to put my hands under your heels. So both the same thing. Go ahead and push. Good. Perfect. Now I'm going to palpate, starting with your heel, to see if there's any swelling, any pain here. Okay. Perfect. Now I'm going to look in between your toes to see if there is any redness, flaky skin, eczema. A little bit on the left side. So what I suggest is to do some soaks with water and vinegar. So you can do like 1 cup of vinegar and half a liter or a liter of water. Make sure that it's diluted, and that usually helps to balance the pH of the skin and to get it back to normal. So for now, I'm not going to prescribe any medicated lotions. I'm going to check the malleolus. Go ahead and tell me when you don't feel this.
No.
And no?
No.
Okay. So what I'm going to have you do, I'm going to have you kind of like open the toes up, and I'm going to try to close them. Don't let me do that. Good. And now I'm going to put my fingers under your toes. I'm going to have you curl them. Come on. Okay, perfect. Everything looks very good and normal. I'm going to have you stand up. I'm going to go ahead and remove my gloves here. And now we're just going to listen to your lungs. I'm going to have you take a deep breath in and exhale. Good. And one more time, breathe in and exhale. Okay, let's go ahead and check your back as well. Breathe in and breathe out. Breathe in and exhale. Okay, so I could not hear any crackles or wheezing, which is very normal. So let's go ahead and do this now. Chart. You don't wear any contacts right now, correct?
No.
So I'm gonna have you grasp the Snellen chart with your right hand. Go ahead and extend your arm all the way, and the left, cover your left eye. And can you tell me what letter this is?
L.
So go ahead and read the whole row, starting with the letter L.
L. T. F. P. H.
Okay, good. And what color do you see here?
Red.
In here?
Green.
Right. And what number do you see here?
3.
In here?
2.
And which circle is smaller, 2 or 3?
2.
Okay. Go ahead and switch eyes now. Perfect. And now can you tell me what letter you see here?
H.
Go ahead and read the whole row, starting with the letter H.
H. P. F. T. L.
Okay, and what color do you see here?
Green.
And here?
Red.
What number do you see?
7.
And here?
5.
Which circle is larger, 8 or 7?
8.
Okay, perfect. That looks good. Now I'm going to show you a few cards. I'm going to have you tell me kind of like your interpretation of what you see, okay?
Okay. I. Hockey. Plant. Spaceship. Scarf. Lips. Peanut.
Okay. Definitely everybody has their own interpretation, so I think it's still within normal. We're going to go ahead and just show you some pictures now. And I'm going to ask you just to slightly describe what they're doing and if you think it's, where do you think it is? Like what kind of environment?
They're jumping, and it's like a park or a forest preserve.
Okay.
They're brushing their teeth, probably in the bathroom. Kids are running at a park. She's whispering a secret at a park. Friends are whispering secrets to each other. Little toddler is playing with her dad.
Okay. That was very good. So let's go ahead and write this down for you. And right from here, I'm going to send you to the blood. You're going to just take a few samples. So we're going to check your chemistry and CBC. So we're going to do a white blood cell count, red blood cell differential, and also we're going to check your cholesterol and your A1C to make sure that you're not at risk for developing any diabetes. Do you have any questions for me?
No, not at the moment.
Okay, perfect. Thank you very much. Thank you for coming in, and I'll see you soon.
Okay, thanks.
Okay, Casey. I'm going to put gloves on and take a look at your face and scalp. You said you were experiencing a little bit of swelling behind the ears. Just want to make sure and see if it comes from the face. So what I'm going to do is I'll first slowly palpate and look for any swelling or fluid buildup.
Okay.
Taking a look at the forehead first. I'm Not noticing any redness. Skin looks clear. Trying to look for any skin growths. Something that would indicate the reason why you're experiencing the redness. Since the skin of the scalp is interconnected with the face, we want to make sure that we're covering both parts. Slight redness on the nose. This could indicate a lack of oxygenation. Also assessing the décolleté area. Just gonna have you turn your head towards the right. And we're taking a look at the hairline. Assessing each hair follicle and looking for gland oils. You mentioned that you're having some redness and swelling behind the ear. When did that start?
Started about 2 weeks ago.
scalp area is definitely a little bit more swollen as we're approaching the ear. I'm not noticing any papules or vesicles. I'm not noticing any dry patches or alopecia. Seems like there is normal hair distribution. Have it turned towards me now. Noticing a scar here on the side and a slight beginning of hair loss. Okay, I'm going to go ahead and take a sample of that. First, I'm going to apply an anti-inflammatory oil at the base. It's just going to scrub off the cells that are superficial. And now we're going to insert the sample in the enzyme package. going to apply an anti-inflammatory balm that helps with healing. Okay, I'm gonna have you turn now. Right. Okay, I'm going to focus on the first half. And go ahead and tell me if you feel this 1 or 2 or 3 puffs of air. 1, 1, 2, 1, 2, 2, 1, 2, 1, 2, 3, 1, 1, 1, 1. Okay. What I'm going to do is I will apply a treatment along the hairline. So this is going to feel a little bit wet. Go ahead and tell me if you feel this cold or warm. 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 Cold. Cold. Warm. 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 Okay, there's definitely a sensory problem here, and what we could do is to apply a treatment that lowers the swelling, and that will definitely increase blood flow. That has anti-inflammatory oils. They're very potent, so we're going to apply just a few drops on the part that we need to treat. And we're going to distribute it evenly along the scalp. Make sure that it is absorbed and all the enzymes are being transferred. ahead and tell me if you feel this on the left or right of the part.
Right. 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 Left. Left. Right. 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 Right.
Alright, so you're going to feel something a little bit cold. This is a treatment, helps to lower inflammation. And according to how it looks, I think this is the best that we can offer. It helps to balance pH. And to restore the normal flora. Go ahead and tell me if you feel this 1 or 2.
2. 2. 1. 2. 2. 2. 2. 1.
Okay. So as we go up on the scalp, it definitely feels like it's normal, and I'm not seeing anything concerning. I'm gonna go ahead and check your right side. tell me if you feel this sharp or dull.
Dull.
Does this feel dull all the way?
Yes.
The same thing, go ahead and tell me if you feel this sharp or dull.
Sharp.
And does this feel sharp all the way?
Yes.
Okay, do you feel this sharp on the left or right of the part?
Right. 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 Right.
Okay. I'm going to apply a gold serum. It will help to bring down inflammation and redness. We want to make sure that it goes a little bit on the hair follicle and on the first inch of the hair growth, also on the scalp, and that we're massaging it properly. really good. I'm not seeing any more swelling as we're going up. Using a little bit of gua sha therapy to bring down any swelling that we have in the neck. It also helps to tonify the muscles. It increases circulation. Definitely looks a little bit better. We did an anti-inflammatory treatment on the scalp and neck muscles. We did focus a little bit more on the scalp, and that usually helps to bring down the redness, and you're going to experience definitely less itching, and it's going to feel very fresh and hydrated. going to first take a look at the hairline, and today I'm going to do a scalp treatment as well, but the main focus would be scalp and hair. We're definitely looking for some inflammation and see if there's anything that we can do to detoxify and reduce any swelling. Taking a look at the base of the hair. I'm going to take some measurements first. I'm noticing a little bit of swelling. That definitely goes towards the center of the scalp. Just slowly tapping. We're looking for any neurological disorders, something that would definitely be shown in the main cranial nerves. I'm looking for any pulsations or changes. Taking a look at the skin, I'm noticing a little bit of flakiness, dry skin, something very similar to eczema. So we're going to look into a treatment to increase the gland secretion. So looking at circulation and see if I'm noticing any redness as I'm pressing down on the scalp. That could mean a lack of oxygenation. Okay, I'm gonna have you flip over. Okay, I'm going to go ahead and expose the hairline at the back of the neck. I'm going to go ahead and brush the hair. Noticing a little bit of redness at the base of the skull, and it looks like it's a scar. Any injuries?
No, not that I know.
It does look like you have natural wavy hair, and I'm not seeing any signs of alopecia at the base of the skull. Definitely going to take a look everywhere and see if there's anything abnormal. Skin is a little bit flaky. I was expecting this. I'm noticing some papules here and there. It's very similar to a light case of eczema. I'm going to take a sample and to see if we're seeing anything abnormal. Okay. going to touch you with 2 pressure points or 1. This is what 2 is going to feel like. And this is what 1 is going to feel like. Go ahead and tell me if you feel 2 or 1.
1. 1. 2. 1. 1. 2.
Now tell me if you feel this cold or warm.
Cold.
You know?
Cold. 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 Warm. Cold. Warm. Cold. Warm. 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 Warm.
Notice a little bit of redness here. Have you noticed any kind of itchiness on the right lower side of your scalp? going to apply an essential oil that will help the muscles in the back of the neck to relax. I'm just going to go ahead and rub it. Make sure that it is absorbed properly by the skin. This will also help to reduce inflammation in the area and any redness. I'm going to use sensory brushes to desensitize the area before we start massaging it. This will help to automatically increase blood flow. We're also focusing on the neck and upper back, spinal cord. This helps to decrease cortisol levels and balance the nervous system. I'm going to apply acupressure using pressure points at the base of the skull to release any toxins that have accumulated in the area. Focusing on the mastate bone as well. Hairline lotion that helps with any rheumatic pains. So it's targeting mainly the upper spine. Going to apply cold acupressure. So this is going to feel a little bit cold, okay? I'm going to perform hair pulling therapy. It's going to help with the trigger points in the back of the skull and to release any of that tension that you are currently feeling. releasing some of that tension that sometimes gets built up behind the ear. Hi, Casey.
Hi.
My name is Dr. Matt. I'm going to do your exam. Can you please verify your last name and your date of birth?
Davis. And 9/10/2000.
Okay. Do you have any allergies to medications?
Amoxicillin.
Okay. Are you taking any medicine on a daily basis?
No, not currently.
Okay. Go ahead and tell me a little bit about why you're here today and what would you like to accomplish with today's visit.
Yeah, absolutely. I'm here today because I've been having a pain that radiates down this right side of my body. It starts right underneath my rib area and then just goes into my hip area. It started, I'm going to say about a month ago, and I thought it would go away. It did get a little better, but it did start back up again.
I'm sorry about that. It does seem like there's something we definitely need to address and to figure out what's the root cause of it. Okay, so you did say a month ago. Any recent changes in your diet?
No recent changes to my diet, no.
Okay. Any injuries?
No, I was doing a lot of yard work, so I don't know if that caused it, but no.
Okay. On a scale of 0 to 10, how would you rate the pain right now?
About a 7.
And besides radiating, is it sharp or dull?
It's pretty sharp.
And is it
On
constant?
occasion, no, it's on occasion. It's like on and off.
Okay. Any medical history that I should be aware of?
No,
Okay. Past diagnosis of any neurological disorders?
no, none. Other than migraines, I used to get migraines. I don't know if that's associated.
When was the last time you had migraines?
I'd say about a year ago.
Okay. And do you feel any chest pain, palpitations?
No.
Okay. Trouble breathing when you have that sharp pain?
Yes. Yes.
Okay. Do you feel like you can't take a full breath in?
Yes.
Okay. And have you noticed any sweatiness, like sweaty skin,
Yes.
clammy hands?
Absolutely. Yes.
Okay. Any back pain associated with that?
No.
All right. I'm going to go ahead and put gloves on. Okay. Have you noticed any pain radiating to the shoulders?
No.
Okay, what about jaw pain?
No.
All right, I'm going to put this on your forehead. 99.1. It is a little bit hot in here, so that's okay. Let's go ahead and put this on your index finger. I'm going to have you relax. And this will go on your upper arm. Perfect. So go ahead and relax. You can breathe normal. Blood pressure is a little bit high. 140/63. Let's go ahead and check your oxygenation first. Okay. And we'll slide this down. I'm going to listen to your heart and lungs. Go ahead and breathe normal. I can hear only S1 and S2. No S3, no S4. Go ahead and take a deep breath in and then exhale. And again, breathe in and exhale. Okay. I'm going to listen to the sides, so I'm just going to lift your arm a little bit. Breathe in and breathe out. Okay. Relax. Okay. I'm gonna go ahead and just check your pupils. Go ahead and look straight at my nose. Okay. Go ahead and give me a big hug. A little bit of roughness in the back of the throat. And are you experiencing any toothache?
None at this time.
Go ahead and close your eyes. I'm going to check your balance. Can you please tell me when you don't feel the vibration anymore?
Stop. 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 Stopped. Stopped.
Okay. Keep your eyes closed. Tell me if you feel this equally on both sides.
Yes. 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 Yes.
Okay. Now I'm going to touch you with two textures. One is going to feel sharp, the other one is going to be dull. This is what dull is going to be like, and this is what sharp is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull. Sharp. Sharp. Shirt. Shirt. Doll. 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 Shirt.
Okay, very good. I'm going to go ahead and palpate your arm. Let me know if you feel any kind of pain. I'm going to start with the one that you said you're not feeling any pain. Okay. I'm not noticing any clubbing of the nails. Capillary refill is within 2 seconds. Any pain here?
No.
Okay. I'm not noticing any edema. Normal skin perfusion. Any pain as I'm palpating here?
No.
I'm noticing a little scar here. It seems like there was a burn. Is that correct?
Yeah.
Okay, looks like it's pretty well healed and has been like 2 years at least.
Yeah.
Okay. Just going to take some measurements here. Go ahead and relax. Going to look on the scalp as well. Okay. I'm gonna have you lay down and I'll examine your abdomen.
Okay.
Alright, Casey, is it okay if I lift the shirt a little bit higher? Okay. And is it okay if I unbutton the pants just a little bit? Okay, so I'm just going to take a look at the abdomen, especially on the right side. Go ahead and relax, okay? And before I palpate, I'm just going to listen. This is going to feel a little bit cold. Diminish sounds on the right side. I'm going to go ahead and percuss. Okay. Just slowly palpating. First, we're gonna go with light palpation, so it's more superficial. I'm not feeling any tenderness. Normal skin perfusion. Rib cage is non-tender. Normal elasticity. Okay, I'm gonna have you flip over and I'll take a look at your back now.
Okay.
Alright, let's go ahead and take measurements. 40. Back is symmetric. Going to palpate, checking for scoliosis. Spine is with normal curvatures. I'm not feeling any deviations. Skin is also perfused. I'm not noticing any skin elevations that would be concerning. And also no tender points at this moment. Go ahead and tell me when you don't feel the vibration anymore.
Stop. Stop. Stop.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. 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 Cold.
And did you feel it cold on all 4 points?
Yeah.
Go ahead and tell me if you feel this on the left or right.
Right. Right. Left. Left. Middle. Right. Left. Right. Left.
Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Go ahead and take a deep breath in and then exhale. And again, breathe in, exhale. Okay, I'm going to go ahead and check your legs and your feet now. Alright, just going to go ahead and look in between the toes first. Just checking for any eczema. And capillary refills within 2 seconds in both sides. Going to palpate for pedal pulses. I'm going to listen to see if there is any bruit. Go ahead and wiggle your toes for me. Very good. Going to check your Babinski reflex. Normal. Normal. Going to check your balance as well. Go ahead and tell me when you don't feel this vibration.
Stop.
Okay, go ahead and pull your toes towards you. Good. And now I'm going to have you push with the pads. Good. I'll slide my hands under your heels. Go ahead and push as hard as you can. Okay, good. I'm not noticing any calluses. Any pain with palpation? Any pain here?
When there's pressure, yes.
Okay, I do feel something a little bit swollen. What we can do is to maybe do a biopsy and see exactly what it is. I'm not noticing any redness. It is round and a little bit protruding. And it does hurt, right? A little bit when I press it. Okay. Alright, let me go ahead and check, make sure that we're not feeling anything else. Just checking for any edema. Okay, very good. Okay, so I'm just going to go ahead and take the gloves off. I'm going to prescribe an anti-inflammatory ointment for the nodule that we felt on your left foot. And I'm going to have you apply it 2 times a day, 1 time in the morning, 1 time at night. Make sure that you put socks after you apply it so that it stays on the skin and it's not wiped away by the surfaces that you're touching. Also, don't take any other anti-inflammatory medication while you're on this ointment.
Okay.
All right, it should go away soon. Do you have any questions for me?
No.
It was very nice to see you again, Casey, and I'll give you a call back to see how you're feeling in a few days.
Okay. Thank you.
You're welcome.